Hello and welcome to The Big Question on NDTV Profit. I'm Vikram Oza. Now, for most Indians today, health insurance is supposed to be that safety net for us, the one thing that stands between a medical emergency and huge financial distress. But for an overwhelming number of individuals and families today, that safety net is being brought to question. The answer is in the amount of premium one has to pay for health cover. Premiums have been rising, and they've been rising sharply, 25%, even 50% in some cases, and that is quite high. And not just that, even if you pay the high premium, often claims get delayed, they get denied, or they are approved only in part. So patients who are recovering from illness, they are waking up to this second shock that they have to go through. And that is quite disturbing, which could be a heavy bill as part of that contribution that you yourself have to make as a patient, or even a rejection letter that you never ever expected. And here we're not talking about a handful of isolated complaints, because surveys are showing that over half of all policyholders, they are complaining about their claims getting stuck in limbo. Now, the insurance regulator, the IRDAI, has its own data that it puts out. It shows that nearly 26,000 crore rupees worth of claims have been rejected last year itself. And that is quite a jump, a 19% jump. And we've been speaking of dropping inflation as well. Well, medical inflation is not the exception as these prices fall. In 2025, medical inflation stood at 13%. But premiums haven't cooled off. In fact, they continue that upward march. And then there is the other issue, which is of GST as well. Now, GST on health insurance becoming that pain point, because you remember it has been slashed to zero. And yet, nearly half of all customers are saying that they never saw the GST benefit for the health cover that they purchased. So it's important to ask why health coverage is becoming more expensive, more unpredictable, and that too at a time when India is pushing to widen that financial protection for citizens. And indeed, health cover is a part of that protection. This is where the business side enters the picture, because hospitals are pointing at rising technology and treatment costs. Insurers, on their part, they are arguing that claims are swelling and risk elements are changing as well. So each side is blaming the other for inflating costs. But while all that is playing out, this argument is going back and forth, the common Indian is ending up paying more for less very often. And now, as per media reports, as we understand it, with that kind of backdrop, we understand that the government is likely to intervene. So we could have caps on premiums. We could have tighter disclosure norms to be made by insurance companies. Perhaps there could be limits on agent commissions and, yes, a possibility of greater transparency in billing and claims as well. So all that could be in the pipeline, which really brings us to the heart of the big question this evening. Would a government crack down on health covers? Would it be justified? Should the government put an end to the punishing premium, something that patients in India definitely need? And to take on this debate, let me introduce you to our panel of experts. Joining us on this show, Dr. Rajiv Agarwal is president of the Association of Medical Consultants. He's joining us this evening, along with Shilpa Arora, the co-founder and CEO of Insurance Samadhan. Also with us to give us a perspective of how consumers are thinking, Sachin Taparia is with us as well, the chairman and founder of Local Circles. Good to have you with us. Nilesh Sathe is the former member of the insurance regulator, the IRDAI. And Abhishek Kumar is the founder of Sehaj Money and is also, of course, a SEBI-registered investment advisor. Thank you for making the time and joining us. Let me begin by asking you, Sachin Taparia, what are consumers saying? The insured, they seem to be really at pain when it comes to these rising premium. What are they saying about the size of the premium that they pay and the kind of delays that happen in settling claims?
Absolutely, Vikram, you put it really well. Paying more for less. I think that summarizes how the consumer is actually feeling. And, when we say paying more, it's essentially premiums post-COVID have really gone up significantly for a lot of people. Over a 3-year period, many individuals, including many senior citizens, have seen their premium go up by 100 to 150%. So that's huge, cumulative increase as compared to what they were paying back in 21 and 22. So, the premiums are increasing. GST came about. There was hope that premiums, would fall by anywhere between 12 to 18% because, now health insurance is being exempt. But that's also not happened based on our latest data that we released earlier this week, where many of them are saying that, look, my premium has still increased. So essentially, I'm not sure when I renewed the policy whether the benefit of GST was given to me or was the base price increased so much that, there was really no benefit. The effect of the benefit got wiped out. So that's on the premium side. On the claim side, we have gotten hundreds of stories over the last couple of years, I must say, and they all follow a very similar pattern, which is, the patient is ready to go home. They are ready to be discharged. They wait anywhere between 6 hours to 48 hours on a cashless claim, which is pre-approved to actually go home. Which is extremely unfortunate because, the patient has been admitted for a surgery 3 days, 5 days, 7 days, and they're finally ready to go home. And, they get ready at 9 a.m. in the morning. And we've had many patients say that, look, I left the hospital at 9 p.m., right? So essentially the process of filing a claim for final processing is also broken between the hospitals for many hospitals, but largely on the insurance company side, where we are still doing emails, we're still doing phone calls, aaya hai, nahi pahuncha, nahi mila. That's the kind of conversation that happens between insurance desks, the patient, and the insurance company, essentially. So I think it's really high time that IRDAI, of course, does something on the premium. They've announced something before. Yes. I think yet to be properly implemented. But then also on the claims processing side, we are in the world of AI now. We are in the world of, web-based systems, right? Why can't we have a transparent system where the patient gets a message that your claim has been uploaded the moment they believe that it should be uploaded, right? And all parties have access to the same timestamp, the same data, right? So people can clearly see what is actually happening with that claim.
Technology should facilitate that. And you have a strong point about that because of the way this is moving. Dr. Rajiv Agarwal, you think otherwise?
I would like to add to what he's saying. Basically, now for claims above 1 lakh rupees, KYC is mandatory. Now, this is another time-consuming process which the insurance companies have put on the hospital. Now, doing a KYC is not the hospital's job. It is the job of the insurance company. They can always do KYC of each and every client they are insured, so that this delay is not happening. Secondly, whenever patients get admitted for packages, most of these hospitals, insurance companies, what they do, they just, say laparoscopic cholecystectomy, the package rate is say 1 lakh rupees. They will initially give an approval of 50,000 rupees and they will say, you send the final bills for approval at the time of discharge. Now, I don't understand when the packages have been fixed by the hospital, why do they need to have this double process? And, ultimately, it is time consuming for the insurance companies, TPS, as well as the hospitals. So somewhere down the line, IRDA and insurance companies will have to come together and make this claim process simple for the hospitals as well as for the insurance companies.
A lot of buck passing, and in the meantime, the patients suffer between the insured and the insurers, and indeed the hospital that is involved as well. Nilesh Sathe, a lot of questions coming your way in terms of how insurers are kind of treating the insured right now. And to protect their interest, when we talk about more for less, we're talking about premiums going up, but the kind of resolution that you have on the claims front and how quickly you have that, there isn't that much of that delivery happening. So a lot of asks over there. But start with the premiums and why you think they are so high and what the regulator needs to do to ensure that they don't keep rising at the pace that they are despite medical inflation going down and GST cuts having been announced. Nilesh Sathe, that was for you. Mr. Sathe, if you can unmute yourself, then perhaps we'll hear you.
Yeah, I fully agree with whatever woes of the insured have been expressed here. We have to find the reasons for that. And IRDA has recently revised the instructions regarding settlement of claims of health. And they have made it mandatory that within 4 hours of discharge, the patient's bills should be settled by the third party administrator. A couple of things have been done by IRDA. The biggest is reduction of GST, which government has done, but that is effective from 22nd of September. Not even a couple of months have passed. So expecting immediate, reduction in premium probably may not be feasible. Let us wait for a while. Second is after COVID, we have seen that medical inflation has certainly gone up substantially. Third is during COVID, IRDA and government had asked insurance companies not to increase the premium. And everybody knows that during COVID, a lot of losses have been incurred by insurance companies. So they had to increase the premium later on. Now, premium is becoming costly is a fact. And if at all we think that health insurance companies are making huge profit by increasing the premium, that is not so. Most of the insurance companies are making meager amount of profits. And there is a science behind this because morbidity is continuously assessed. And we have seen that based on morbidity only the premium can be charged. They cannot charge it as per their whims and fancies. Again, as the age goes up, the premium goes up. There are certain companies which charge premium increase in slabs. Like if you cross 60, it will be increased. If you cross 65, it will be increased like that. So sometimes it happens that a person at 64 has got to pay certain amount of premium for the last 3-4 years and suddenly it goes up when he crosses 65. So this is also one more reason. Transparency is absolutely important, and with usage of AI and digital, I'm sure the things should improve. Transparency, why I'm saying is, like when somebody goes to a hospital, he doesn't know what the hospital is going to charge him for ECG or for X-ray or for any procedures. Why it should not be displayed at the hospital itself? And for that, gradation of hospitals is required, and for which a hospital regulator is a must. Because we have come across a lot of cases where a 20-bedded hospital has been charging the rates of 100-bedded hospital just because he is entitled for a higher sum assured. And that is something which is to be checked. So these are a couple of things, but I fully agree that ultimately it is the consumer who should not be suffering. And for that, the more the transparency we have, the better will be the results.
So you've enumerated a lot of different spaces that need attention. In the meantime, there's a lot of suffering, and we're talking about deeper penetration of health insurance in the country. At a time like that, Shilpa Arora, do you think a lot of people looking at high premiums, when people talk about how difficult it was to settle claims, how much time it took, you know, the kind of bits that are coming through the local circle survey as well, do you think these are points on which consumers are now getting dissuaded from getting a health cover?
So as Nilesh pointed out, customers, policyholders are getting into a vicious circle where they are in between the hospitals and the insurer. So as Sir pointed out, when the hospital realizes that a sum assured is higher, the billing increases. This is a fact. A lot of modern treatments are now there, which are also very expensive. Lifestyle disorders are more now. A lot of cancer patients are there, and the treatment is really expensive. So this is actually putting a burden on the insurer, who are not actually making a lot of profit. So there is a problem that premium are increasing, and we need a hospital regulator. Basically, IRDA is taking a lot of steps in terms of policyholder protection, but there's nothing at the hospital end. So we need a hospital regulator, and once these things are fixed, then only the premium would come into our control. And yes, people, especially senior citizens, are facing a lot of problem. People in tier 2, tier 3 cities who cannot afford such increasing premiums are actually stopping their insurance. At some point of time they had insurance, now they are unable to pay the premium. So this needs actually to be fixed by a hospital regulator, which is the need of the hour.
Hospital regulator is what we're hearing a lot in this discussion, Dr. Agarwal. On the one hand, you have insurers saying that costs are rising because hospitals are inflating bills. I'm just wondering how justified you think these premium hikes are. You're at the other end of the spectrum. Tell us, do you think customers are simply being made easy targets over here, that you need a hospital regulator because the higher the premium, the higher the insurance cover, it seems like the hospitals are going to charge you even higher. So a customer is going to be feeling the pressure from both sides.
Not really. Actually, it is the other way around. Most of the hospitals have a tie-up with the insurance companies. And believe me, the charges what the insurance companies are offering to the hospitals are much lower than the patients who are actually paying cash in the hospital. Now, let me tell you some statistics which all should know. 70% of the healthcare, private healthcare, is catered by small and medium-sized hospitals, and 30% is catered by these large corporate hospitals. But as far as revenue or the insurance claims or whatever is the monetary component is concerned, these 70% small and medium-sized hospitals just get 30% of the revenue, whereas the 30% patients in this corporate hospital amount to 70% of this total monetary gains. Now you need to understand, if you really want to get down the premium of the patient, you want to give quality treatment to the patient, the insurance company needs to understand that they have to be slightly sympathetic with the small and medium sized hospital. Today, if I am a surgeon, laparoscopic surgeon, insurance company will offer appendectomy to my hospital, even if I am a senior surgeon of 25 years of experience, they say 30,000, 40,000. But the same surgery, if I do it in a corporate hospital, the insurance company will pay 2 lakh rupees. And in my hospital, after deducting all the medicines, the anesthetics and other things, I will end up gaining just 10,000 rupees or 8,000 rupees. Whereas if I admit the same patient in a corporate hospital, out of 2 lakhs, I at least stand to gain 40,000, 50,000. Now you need to understand what I'm saying. Out of 2 lakhs, still the doctor will get just 40,000 or 50,000. 1,50,000 will go to the corporate hospital. So it is really the corporate hospitals as well as the insurance company. Now, if the insurance company are able to give the reasonable charges to the small and medium-sized hospital, I'm sure the patient will never ever try to go to corporate hospital, because the personalized care is always there in a small and medium-sized hospital, because the individually owned doctor knows if this patient is happy, he will get 10 more patients. Whereas we all know how the corporate culture works.
But Dr. Agarwal, wouldn't you agree that everyone needs access to hospitalization and healthcare to the level that they are aspiring for, that they have signed up for? And that there should be a certain level of standardization in what you get, whether you go to a small and medium hospital or you go to a corporatized hospital. The kind of insurance cover that you get, the kind of services that you should be getting, that you signed up for, should be delivered. And there should not be this kind of differentiation. And is that the need, why we need a regulator to ensure standardization?
See, already government has implemented this regulation, and these charges have to be displayed in each and every hospital on the most prominent place in when you are entering the hospital in the reception area. So all the charges are displayed by most of the hospitals. If a hospital is not doing that, the patient has the right to complain to the local corporation under whom the hospital is registered, and the corporation can take necessary action. So as far as this regulator is there already, as far as the Maharashtra Nursing Home Act is considered, in that all these regulations have been put forth, and the corporation where the hospitals are registered, they are following it strictly. Now, as far as patient is concerned, definitely patient has the choice, and patient should be the only person who should have the right to decide where he wants to take the treatment. But at the same time, it has to be viable for the hospitals also to give the same quality treatment at the price what the insurance company is offering. Many of the insurance companies put so many riders on the hospital that it is impossible to maintain the quality to give the same standard of care and treatment to the patient. And that is the reason why many of the times patients suffer. So what I appeal as a hospital owner, as a doctor, and as an association representing 16,000 doctors across Mumbai region, insurance company have to realize that small hospitals are the mainstay, and if they are able to tie up with them. And one more important thing where we want to cut down the premiums and this, we have to stop these bogus claims, which are, the main reason for actually increase in the premium of the patient. And here, somewhere down the line, we need to understand it is not just the hospital or the doctor who's involved. It is the insurance companies or the TPS, some represented from there also. Even they are hand in glove with these hospitals. That is the main reason where, these bogus claims amount to crores of rupees, and that leads to actual increment in the premium.
I want to take that across to Sachin Thapare, and I'll do that in a moment. But Shilpa Arora, do you see a rebuttal over here for the kind of claims that are being made, at least from the small and medium hospitals that Dr. Agarwal is pointing towards. What do you think insurance companies need to do at this stage when you're seeing higher premiums and hospitals, he says, for the kind of reach and for the kind of services that patients should be getting in these hospitals, they need action more from the insurance side. Do you agree?
I think government is already, even IRDA has done that cashless for all, and they are trying to, insurance companies are taking maximum hospitals in the cashless tie-up. So this is already on since last year. But again, as a policy holder, it is my choice to choose. I mean, if I have insurance, say of a good amount, why I would go to a smaller hospital? I would go to a bigger hospital.
Correct.
That's what we see.
Correct.
Yeah, so I think that will not solve the problem, though the government is taking those steps of, incorporating all these smaller hospitals as well. But the problem is the inflated bill. This is my personal experience as well. If you don't know, there may be an over treatment done in the hospitals which inflate the bills.
So there is the
I
problem
think
of the
somebody,
bogus claims as well that Dr. Agarwal is pointing towards. Sachin Taparia,
yes.
what does your data show? I hear 36% claim rejections are citing invalid reasons. Tell me what that picture looks like.
Very clearly, Vikram, it'll be nice to have a hospital regulator. We are also working with the government on standardization of hospital bills. That should come out here over the next 6 months. Already a lot of work has gone into it. And these kind of reforms will help. But to me, I think IRDAI and insurance companies can step forward right now and still do a lot. With AI and with the way technology is progressing, the simplest process reform that can be done is this transparent claim processing. When it's there and you are able to minimize. So what happens is today, the insurance companies won't acknowledge a claim that has been sent to them. And while they have got it, they are analyzing it. They're essentially buying time while, they're supposed to be processing it within, or they're supposed to be acknowledging it within an hour and give their final, decision within 4 hours for cashless claims.
Correct.
But they longer because they don't acknowledge these claims. So I think if IRDAI here puts some checks and balances saying that, look, once a patient is ready, right? Somebody gets ready at 9 o'clock, by 10 o'clock, the hospital is supposed to do their bit. That
Yes.
can be part of hospital standardization. And within 3 hours, right, there's no reason for that patient to stay in the hospital beyond 1 p.m. basically.
Correct. So that's one part of it. And there is a system that can be created. But Abhishek Kumar, when you're looking at the people who come to you for financial advice and how much they are factoring in the rising health costs, and they can be quite substantial. How much of that are they actually doing? Because now I'm hearing that consumers, when they see premiums rise at the rate that they are saying, hey, I better invest better rather than set aside all this money towards premium, because this is going to be a big drain. You see that happening? What is the correct answer from a financial planner's perspective?
Yeah, thanks, Vikram, for having me. So to that, I would answer in manner that health is a multi-year risk. It's not a one-time risk that you can avoid by keeping or saving money or small sum of money. So once you have an ailment, that will prolongate for multiple years, right? So it's difficult to think in that terms that you just save the premium and invest in a different set of instruments. And in case you face an ailment, you'll pay for that. But once that kind of diagnosis is done, you'll probably face multiple claims over the year. And every time you can't keep on doing it. So we always advise it's better to look for alternatives like going for kind of deductible or co-payment so that they can reduce the premium to a larger extent and still manage from their own savings plus a larger chunk from the insurance itself. So we generally do not advise to kind of surrender or not take insurance. We always advise to make it a priority to have insurance on their side, especially if they don't want to depend upon public healthcare,
right,
like in the for most of the Indians out here.
But looking at these rising costs right now, when it comes to health cover, and perhaps it needs to be intervened by the government on. Nilesh Sathe, what do you make of the media reports coming through that the government could consider premium caps? Is that a workable scenario, or do you think that's going to distort the market and push insurers away from creating more products and being able to give the kind of service that they need to consumers?
No, the media reports I have also heard about say that government is likely to ask hospitals not to increase their rates and also the insurance companies not to increase their premium for 1 year. This is what I have heard, but still it's not final.
Yes.
One thing which comes to my mind is there is one scheme called PM Jana Arogya Yojana, which is applicable for 70 plus citizen irrespective of their income. Every senior citizen who is 70 plus should have this card of 5 lakh cover. And that is something which should be promoted. And second is for the scheme, most of the hospitals should be compulsorily asked to give treatment up to 5 lakhs per family. Now, this is something which needs to be promoted because premium in case of individual health goes up substantially as age goes up.
Indeed.
This is one scheme of the government which needs to be propagated. Why it is not being done, I don't know.
Yes.
But it will definitely ease the burden of senior citizen to a great extent.
Well, for the moment, consumers are demanding clearer disclosures. They want simpler policies, and that pressure is only rising on the industry to deliver what the consumer wants. The regulator's challenge is trying to balance consumer protection with keeping insurance affordable and viable. And advisors are saying that the real gap is financial literacy as well. That doesn't go away. People buy without understanding sometimes, and they suffer when it comes to claim time. So there is a problem that needs to be addressed at several levels, but the industry needs to rebuild that trust. And that they can do, like it came out in the discussion, through transparency, through faster claim settlements, through plain communication. On that note, we'll have to wrap up tonight's deep dive. A big thank you to my guests, Sachin Taparia, Nilesh Sathe, Dr. Rajiv Agarwal, Shilpa Arora, Abhishek Kumar. Of course, these discussions will continue. We have a lot to discuss, Dr. Agarwal, but of course, we'll keep raising these important questions as we go along. And to our viewers, yes, indeed, the questions are many when it comes to health insurance in the country. This is a country that wants deeper penetration of health insurance, but when premiums rise at the rate at which they are and the claims are not settled on time, it does raise important questions, and we'll keep bringing them up. Here on NDTV Profit, I'm Vikram Oza. Thanks indeed for joining us.